We've been invited to Southwest Surgery Center and El Paso's own orthopedic surgeon, Dr. Keith Johnson. Dr. Johnson specializes in sports medicine and minimally invasive procedures.
Very, very excited to be here this afternoon with Dr. Keith Johnson, orthopedic surgeon here in El Paso. Dr. Johnson, I understand that you just performed a really interesting surgery. Tell me a little bit about it.
Yes, we were able to perform a special type of hip replacement that's called a direct anterior approach. It's a special approach because it allows the patient to have less pain, to get up more quickly, and actually in this case it allows them to go home the same day or the very next day, which is pretty revolutionary for a hip replacement, where in the past you had to stay in the hospital for 4 or 5 days.
Yeah, I was going to say hip replacement, go home in one day, that's unheard of. Is this something new to El Paso?
Well, actually, it's quite new even across the country. It's a very new cutting-edge type procedure that allows you to access the hip without actually cutting muscles or ligaments away from the bone. And the advantage of that is you don't have to necessarily wait for those ligaments or muscles to heal. And so many of the disadvantages or the painful portions of a hip replacement can be avoided simply by not cutting the muscles.
Medical world has come a long way, and I love knowing that Dr. Johnson is right on that cutting edge, and he brings it right back here in El Paso. Is there any way, Dr. Johnson, that we could visit with your patient real quick?
Absolutely. Our patient today is actually a priest for the Catholic Church here in town.
So we're sitting here with Father Raul, and he's had an amazing procedure just done, a hip replacement. What's amazing about it is he's going to go home tomorrow. Father Raul, tell us a little bit what's going on and how your procedure went today.
I was, in the surgery this morning, and right now I am eating, talking with you, and also I want to say something about Dr. Johnson. And so he's a very good doctor, and besides he's a very good friend.
How's he doing, Dr. Johnson?
He's doing fantastic. Like I said, this is the day of the surgery. Most people are walking with a therapist on the left side and a therapist on the right side. He's walking by himself. I'm just holding the IV bag. So he's literally up and about on his own. That's amazing.